Welcome to CCM 135 Communications. My name is Mr. Monclova, and I'm going to be your instructor for this section, which is Chapter 8, the Interviewing Technique. Here are the course objectives for today. Please feel free to pause this PowerPoint at any point in time to take a look at these course objectives, as we will cover them in this section. There are three primary functions of the medical interview. The first function is to gather information from the patient. The second function is to build rapport or to create a relationship with our patient. And the third is used for patient education. There are two common approaches to the patient interview. There's the primary care provider only approach. This is where the patient speaks to the primary care provider and they're really only interviewed one time. There's another approach called the team approach. And this approach can have multiple interviews. So the first interview is conducted by a member of the healthcare team, and the second interview is conducted by the primary care provider or other members of the healthcare team. Typically in physical therapy, when a patient comes to clinic for treatment, their first interview is conducted by the physical therapist who does tests and measures and asks a variety of different questions. Once the physical therapist is done with the patient, they will assign them to a physical therapist assistant. The physical therapist assistant may perform a second interview, and this is to gather additional information to create an effective treatment plan that's safe for the patient. In terms of the interviewee, the patient is typically the primary source of the medical information. However, there are certain circumstances where the patient is not the interviewee. The patient may not be the interviewee when he or she is critically ill or unconscious, has mental impairments, or are very young. Other sources of medical information may include the parents of small children, adult children of seriously ill or disoriented parents, spouses, and significant others, other members of the healthcare team, and of course, the medical record is a great resource for information regarding the patient. The presence of family members during the visit may offer some benefits. So family members may help to communicate the patient's concerns to the healthcare provider. It may improve the healthcare provider's understanding of the patient's problem. It will also help to improve the patient's understanding of the diagnosis and the treatment protocol. It can also be helpful for the patient to remember clinical information and recommendations, to express concerns regarding the patient, and to assist the patient in making informed decisions. There are a variety of different settings in physical therapy: hospital settings, outpatient orthopedic clinics, skilled nursing facilities, home health care, or inpatient settings. We should always observe nonverbal behaviors to help us guide the treatment session. Observations may be helpful in diagnosing the patient or in developing a treatment plan. Some of these observations can include gait observation or posture analysis. There are times where we have to speak to a patient over the telephone, and in this case we would have to have a telephone interview. The healthcare provider is unable to observe the patient's nonverbal communication, such as their facial expressions. So it's one thing that we have to consider, is that we're losing components of communication when we speak to a patient over the phone. In this situation, the healthcare provider has to rely on the patient's tone pacing of speech, and word selection to interpret the patient's condition and attitude. The healthcare provider can also paraphrase to help in this situation. We've discussed different types of questions and statements. So one type of question are closed-ended questions. And these are designed to elect a very short, focused response, such as a yes or a no. An example would be, do you have pain? And the answer would be either yes or no. There are advantages and disadvantages to closed questions. The advantage is to provide a great deal of objective information in a short period of time. So when time is a factor, we may want to resort to closed-ended questions. The disadvantage is that it limits the amount and type of information gained from the patient. So we don't get a whole lot of information out of the patient using closed-ended questions. Open-ended questions are designed to elect detailed responses. Provides objective and subjective information regarding the current physical and emotional conditions of the patient. These questions often begin with who, what, when, where, how, and why. When using open-ended questions, you may want to be careful when using why questioning. There may be no one answer, as a patient's motivation may be complex. Some of these questions may be perceived as confrontational, so we have to be careful using why questions. The patient may feel like he or she has to defend themselves, and they are likely to inhibit further communication or hold back information from the healthcare provider and damage the therapeutic relationship. On the flip side of the coin, why questions may be helpful. It can help us to engage in true collaborative decision-making. It is necessary for the healthcare provider to know what motives the patient has. In addition, we like to know what helps to motivate and demotivate our patients. Sometimes gathering information in terms of motivation can be helpful during the therapeutic intervention. The healthcare provider will often need to know what factors may influence the patient's ability to follow a certain treatment regimen. So again, using open-ended questions will typically give us more information and help us guide the treatment session a little bit easier. We have to be careful with leading questions and statements. These should be avoided at all costs. They may encourage the patient to provide what he or she perceives is the desired answer by the healthcare provider, and as a result, we get inaccurate information. So an example of this would be, your physical therapy session is going good, right? And the patient is compelled to say yes. So we want to be careful with leading questions. There are also indirect statements. These statements help us to establish therapeutic communication with the patient. It helps us to obtain information without the patient feeling questioned as well. So having direct statements in the form of open-ended questions without leading the patient is the desired way of going about asking questions or interviewing the patient.